My name is Jonas Johnson. I'm the chairman of the Department of Otolaryngology at the University of Pittsburgh. I'm a surgeon, and I have dedicated my entire career to taking care of people with throat cancer. In 2016, Marcy Nielsen and I pulled together a team of providers to try to diagnose and then care for people who are suffering from treatment-related side effects.
I'm Marcy Nielsen. I'm an assistant professor in the University of Pittsburgh School of Nursing and School of Medicine in the Department of Otolaryngology, and I'm also the co-director of the Head and Neck Cancer Survivorship Clinic at UPMC. And what we do is we focus on the complex needs of head and neck cancer survivors, and we've brought together a multidisciplinary team to really address those needs.
So as we began to look at our data, we realized that there existed a group of people we felt we were underserving. And this is people who were just diagnosed. That is, they just found out they had throat cancer and they were actually going through treatment. We felt that we could help those people if we intensified our program. So initially what we were trying to do is see people who had throat cancer once a year.
We had begun to look at data. We knew that patients had symptoms after they completed treatment, but we wanted to know more about what happened during treatment. Through some data that we had here at the university from 2012 to 2016, we knew that about 35% of patients had an ER visit or a hospital stay during treatment. And patients were being admitted for things like pain, trouble swallowing, loss of weight, dehydration, nausea, vomiting. So these are symptoms that we felt that we could help address early through identification and then symptom management. So we brought in a nurse navigator to work with patients. So she meets them twice a week. And the goal of that is really early assessment before the symptoms get too bad and lead to a hospital stay or an ER admission. So addressing them with the team early.
I meet with our patients twice a week over in radiation oncology. I meet them on their first day of treatment, and I provide extra care and support throughout their whole treatment. Most of the times they're pretty overwhelmed, and I help guide them through and get them to what they need.
I ask specific questions about swallowing, and I screen patients swallowing twice a week, and I'm able to kind of offer advice on diet modification, strategies. I make sure they're continuing to swallow all throughout treatment, and I make sure that they're doing their swallowing exercises. Before the enhanced care trial, we would tell patients to expect these issues swallowing and here's what you do for them. But it's really overwhelming in the beginning, and when you're getting all this information, you may not retain it, so that down the line, when you start having these problems, you're not sure what to do. By seeing people twice a week and checking in on them and encouraging them and reminding them to continue their exercises, you can really stay on top of issues before they become issues. A lot of people have great family support and that kind of thing, but sometimes they don't, and we can offer kind of that helping hand that really helps them get through it.
I could only imagine if I didn't have those resources I met up front, that I was on my own to travel and visit, it would just be overwhelming. Because there's that fear, the unknown of what you're entering into for this next phase of treatment. So I felt I was empowered with everything I needed to move forward with this treatment process. Because it's enough of an unknown, and you hear about radiation treatment and it kind of overwhelms your mind. But having this team and this focus, I can't see it being any other way.
We can really combine some of the softer sciences and collecting some of these quality of life data points and analyzing that in sequence with our translational information, and how we combine all of that to be able to manage these patients more proactively, keep them on treatment where we know there's an increased chance of survival.
Through support from the Beckwith Foundation, we've been able to start this trial. We hope to see a decrease of 15% in hospital utilization. That's really the goal, is to make sure we have an efficient, effective trial that is sustainable and that we can translate to other areas within Hillman Cancer Center or even the country.
So what we've learned so far is that it's absolutely true people need help. What we've learned so far is that people are very gracious and happy to have this help. And what we've learned so far is that we still have room to make improvements. We can do better.